My name is Rosie and welcome to my channel. Here we give tips on how to beat depression day after day. In today's video you will discover the 4 most common types of medication used to combat depression, as well as some treatment options that have brought great results for those who suffer from this disease. I know exactly what you're going through. I've suffered from depression for years, and I know what it's like to feel this emptiness inside, this endless anguish and sadness. Today, thank God I'm a person fully recovered thanks to the treatment I did. That's why it's important that you watch this video until the end so you don't miss any details. But first I kindly ask you to subscribe to our channel, like and share the video so that the greatest number of people can be reached with this knowledge. After all, what are the medications used to treat depression? First, we need to understand what depression is. Depression is a mental disorder which affects about 350 million people worldwide. Its symptoms include, but are not to, feelings of helplessness and hopelessness, loss of interest in daily activities, appetite or weight changes, insomnia or oversleeping, anger or irritability, loss of energy, self-loathing, reckless behavior, concentration problems, unexplained aches and pains, and also suicidal thoughts. Current popular treatments for depression include antidepressant medications and talk therapy such as counseling or psychotherapy. Unfortunately, these treatments have many drawbacks. AD medication is associated with a high risk of side effects and a low success rate, while therapy sessions are notoriously expensive and often unaffordable or unobtainable for most people. What are the 4 types of medications and medical treatments for depression? Medication for depression comes in the form of antidepressants. There are typically 4 classes of AD medication: SSRIs, selective serotonin reuptake inhibitors, atypical antidepressants, tricyclics antidepressants, and MAOIs, monoamine oxidase inhibitors. First, SSRIs. The SSRIs, selective serotonin reuptake inhibitors, are the most commonly prescribed class of antidepressants. They act on a chemical in the brain called serotonin. The SSRIs include drugs such as Prozac, Zoloft, and Paxil. SSRIs are preferred over older classes of antidepressants because their adverse effects are less severe. However, like all antidepressants, SSRIs can cause an increase in suicidal thoughts and behaviors. They also carry a risk for increased hostility, agitation, and anxiety. In adults 65 and older, SSRIs increase the risk for falls, fractures, and bone loss. SSRIs can also cause severe withdrawal symptoms if you stop taking them abruptly. Second, atypical antidepressants. Atypical antidepressants are a variety of newer atypical antidepressants which target other neurotransmitters either alone or in addition to serotonin. For example, Wellbutrin blocks the reabsorption of the neurotransmitters dopamine and norepinephrine, while trazodone affects both norepinephrine and serotonin. Again, as with all antidepressant medication, there are many possible side effects. Third, tricyclic antidepressants. Tricyclics are among the oldest antidepressants. They work by inhibiting the brain's reuptake or serotonin and norepinephrine. They also partially inhibit the reabsorption of dopamine. Because tricyclics have such a broad mechanism of action, they tend to cause more side effects than the other classes of antidepressants. For this reason, the SSRIs and the atypical antidepressants are usually prescribed first. Again, side effects are usual and severe withdrawal symptoms are often the case if you stop taking them abruptly. Fourth and last, MAOIs. MAOIs, monoamine oxidase inhibitors, are the oldest class of antidepressants. MAOIs have severe interactions with certain foods, drinks, and medications. Combining MAO inhibitors with foods or drinks containing tyramine can result in dangerously high blood pressure, which can lead to a stroke or heart attack. Because of this danger, MAOIs are not typically chosen as a first-line depression treatment. As is usually the case with medication, antidepressants cannot cure depression. At best, they will lessen the symptoms of depression. However, success rates are notoriously low, not much better than a placebo in most cases, while the risk of side effects is extremely high. This is the reason many people in the medical industry refer to antidepressants as sugar pills with side effects. Only there is a better and safer option. Professionals will know or tell you about it. There is too much money involved in conventional treatment methods. You can actually cure yourself of depression using only CBT, cognitive behavioral therapy, techniques combined with some dietary and lifestyle changes. Indeed, in the past, a number of doctors and scientists had reported such successes in medical journals, but this research is now kept hidden by the pharmaceutical industry. For the first time, this research has been unearthed and used to compile a comprehensive step-by-step guide to exactly what you need to do to cure your depression naturally and safely in just a few weeks without any expensive medication or therapy sessions. I know this as I've suffered from depression for 15 years, and I know exactly what it's like to spend money on expensive drugs and therapies that go nowhere. I don't want you to go through the same suffering I do. It was thanks to this method, developed by great researchers, that it helped not only me but thousands of people to definitively cure depression. I'm going to leave the link to this solution in the video description, which unfortunately is little publicized and few people are aware of this method, but which is helping thousands of people to regain the joy of living. I sincerely hope that you too can overcome depression as I did. A big hug and see you in the next